So, did you always want to pursue the medical field, or was this, um, after your dad's heart attack, was it just like, all right, this is what I'm going to do?
Yeah, it was definitely after that, and definitely more towards my junior year of high school. Not surprising, probably to you at all, but I was a competitive dancer all the way up until my year, and so I have a very obsessive mindset. That was my entire life prior. So, like, I did
Mhm.
well in school, but that was all of my focus to the end. So I think that's kind of why maybe I didn't have a whole lot of like big future dreams. I was just kind of living in the moment with that. And so
Mhm.
as soon as that, as soon as that ended, then I was able to kind of focus more on like, okay, what is my future goals as a professional and what do I want to do? And that's where nursing came up. So
And then with nursing, once you got done with school, what did you focus on more? What did you gravitate towards more,
the
specialty wise?
brain,
The
yeah, the
brain?
brain, yeah, definitely. I applied to a few different neuro units, but I was lucky in college. I was the only student that was able to do it just by chance. But I got to have two ICU rotations for clinicals, and I just loved the ICU. It was just such a different pace. I felt like there was just so much more to learn. Um, and I thought that the nurses were just so attentive and calm and disciplined, and I really looked up to them. And so
Mm.
I knew it was kind of a long shot as a new grad, but I really wanted to get into the ICU. And so I applied
Mhm.
at the hospital that I did clinicals at, just, since I had the experience. And I landed the neuro ICU job and I was so stoked. And looking back on that I learned so much there. The nurses there were just so talented and dedicated, and um, really taught me a lot of teamwork too. I think that was a really special unit that really collaborated and worked together and found ways to work together.
Mhm.
Because it is really easy to just get lost in your room with your patients and not really come out and not really check on your peers, but that was just not the environment that they created, which was really cool. So um, and then it was a learning hospital too, so we had a lot of residents and different levels of neurosurgeons working with us on the floor, and so they
Mhm.
were a young crowd too, and so it was fun to work with them. And they were so excited with what they were learning that they were really quick to pass that knowledge on to us and quiz us at the bedside. If there was a symptom, it was always a test of, why is this happening? What do you think? Kind of force us to really have a deeper understanding of what was going on.
Mhm.
Uh, but yeah, I look back really fondly on that job for sure.
And so, what was the coolest thing that you saw in the neuro department?
I would say TPA working, honestly. And I think that's how, and I like, the scope of what we got to do and see. I mean, I got to help with like, various bedside procedures. We were literally opening people's heads. Like
Mhm.
that's cool, but I think actually seeing somebody come in with full stroke symptoms, and you know how this usually goes, that this usually, a lot of times it's not going to come back to normal and baseline. um,
Mhm.
but seeing them actually give TPA, which is a clot busting agent, that we give
Mhm.
for strokes. If you give it at the like it's chance, if you give it at the exact right time and it just happens to work on that patient and not cause any problems, then they can have a full recovery. Um, and so actually seeing that in action, because you are doing assessment it's technically every hour, but most of us are in there like every 15 minutes, just making sure everything's going okay.
Mhm.
Actually see go from, hemiplegic, where they're not moving, they're not speaking right, maybe they're not even conscious oriented or anything like that, and just seeing
Mhm.
that minute by minute start to dissolve and then actually go back to normal, and now they're moving their entire body and they're back to baseline is so cool. It's like honestly really fascinating to just kind of see everything come back in that way. And of course, they're excited too, and family could not be happier. It's just like a really rewarding experience. So I would say that was really,
Heavy.
really, really cool. I
Are you there?
definitely leaning into more of the bright things that happen in the ICU because they were definitely a lot fewer. I think were more of the rewarding experiences for sure.